Oh, okay. See, I'm doing what we all do, is sit for long periods of time. When you're sitting for 8 hours, do you notice that your back gets more stiff? So our body's adapting to the seated position. And we all sit with bad posture, I'm included. So I'm sitting down here and I'm folded in my back, my hip flexors are in a shortened position, and I'm laying down collagen. We're getting tighter every single day. And that's why it compounds, it builds up over time. So in this program, in this exercise routine, this video, we're just gonna go through the simplest routine that you can do on a daily basis to unravel that seated position. Let's get right into it. Okay, let's get into a simple routine of unraveling the seated position. So it's gotta be around thoracic spine mobility, hip mobility, and ankle mobility. So we're gonna go down to the ground. We're gonna see if we can follow along with Blair right here. I'm dropping down to the ground. I need to be able to open up my thoracic spine. So what I'm gonna do is I'm gonna lay down right here and I'm gonna chin tuck, keep my knees bent. You can put your hands right here. You can put them up overhead, whatever's comfortable for you. We're just gonna take deep breaths and do this for 1 minute, loosening up the thoracic spine. After I'm done with that, the first thing I'm going into is my hips. So I'm going top down. So now I'm going into the hips. I'm gonna flip over and get into an all fours position. I'm gonna drop this foot underneath the back one. I wanna keep my low back in a neutral position. And now I don't wanna twist up to the side. I just wanna drop with my pelvis going straight down into the ground. And now I'm gonna use this glute muscle to push me back up, and I get down a little bit lower. I'm just gonna do 5 of these. So I got 1 minute with my thoracic spine mobility, and then 5 repetitions. 1, 2, 3, 4, 5. And then coming down, 1, 2, 3, 4, 5, 5 coming up. So I'm doing 5 sets of 5-second holds and 5 seconds of engagement. It's the 5-5-5 system. We just taglined it. So I'm doing it 5 times, using those muscles so that I get deeper into the stretch. And then I'm gonna flip and do the other side, driving back. Remember, I'm not chasing that stretch to one direction. I wanna come straight down, because what we're working on is hip mobility, not a particular stretch. It's actually getting into more mobile position for our hip, because the hip is getting stiff. The muscles are stiff around it, but I wanna use those muscles so they'll loosen up. And then I drop down into it. My pelvis is coming down. My back's in a neutral position. I'm stabilizing myself with my hands. I'm definitely not doing this. I don't want to work on low back mobility. I'm just using these glutes to fire me up and then dropping back down. So I do 5 of these. So this is a quick and easy way to unravel that seated position. So I got my thoracic spine mobility. I got my hip mobility on the back side. Now I need to get my hip mobility on the front side. So I'm just coming right here. I'm dropping into this position. My pelvis is coming forward and I'm squeezing my back glute for 5 seconds. And then I'm gonna come up and then 5 seconds squeezing that back glute. So I'm doing 5 repetitions of this. 5 seconds squeezing that back glute. So you're just sticking with those 5-5-5 because it's really easy and you're able to get this done. And what do you guess? How many minutes do you think it's gonna take? I think it's gonna take 5 minutes. So 5-5-5s. So right there, I'm gonna shift sides, opening up the left glute. But you'll notice if you're doing this, that this hip and your pelvis is you're opening up the front side of it as well. So I'm squeezing that back glute, and that's really important. To squeeze the back glute, come up out of it. We're just doing 5-second holds. I can put my hands on the inside right here and really drive that right knee out so I'm getting into my groin. None of this stuff should hurt. This is just a consistent routine to unravel that seated position. And you do it consistently, you're gonna feel really good. So we wanna do it anytime. If you could do it in the middle of the day, if you're sitting at a desk for 8 hours a day, we do it at lunchtime, open everything up. 5 minutes is gonna be worth it. So now the third thing we're gonna come up with the camera right here is that we've got to work on ankle mobility as well. So I worked on my hip mobility on the front and the back. I worked on how I'm folded forward with my shoulders. I've opened that up. Now we need to get into our calves and our ankles. So what I'm gonna do is I'm gonna lift my heels up and hold that position for 5 seconds. hold it for 5 seconds. Really good to take 5 seconds, slowly lowering down, 5 seconds up, then slowly lower down. We're just gonna do 5 of them. And then now I'm gonna get into my ankle stretch, holding it for 5 seconds. I'm gonna come out of it, 5 seconds. I'm gonna do 5 of them. I'm gonna switch sides, do 5 seconds. Knee totally straight. You're gonna feel that stretch really high up right here, right behind our knee. And I'm just relaxing and then getting back down into it. Sometimes, I mean, for me in particular, I get really bored stretching. So these 5-second holds are really easy to stay engaged with. It's a really quick and dirty, easy way to get into ankle mobility, hip mobility, and thoracic mobility. Now we want to get into our activation. So we activated the calves, we activated the hips, but we need to work on our hip hinge. So we've got to be using our hamstrings and our glutes when we're doing activities. So hold on one sec, or follow me and we'll grab a chair. So we set up right here. I'm gonna put it right here. You can do this against a wall, against a chair. So what I'm gonna do is measure my foot length away from the chair right here. I'm gonna angle, allow my chest to come down, push my butt back. It was pretty far right there. I'm driving my hips forward, driving my hips back, touching. If you feel like you're unstable right here, just move those feet back a little bit. So I'm touching right here. This is a backward and forward motion. And so I'm using those glutes, and I'm gonna do 5 repetitions. I'm gonna rest about 10 seconds, and I'm gonna do 5 repetitions using those glutes and the hamstrings. You know, if you're on your lunch break at work, you're not trying to get really sweaty. So this is an easy routine. We got one more thing to do, so stick with me. Okay, last exercise. Make sure that you follow us for exercises and routines that we use here in the clinic that fix pain problems. That's what we're specialists in, is fixing pain problems for our clients and making it as easy as possible. So if you have any questions about the program, please let us know. Questions about the exercises. We want you to get the best benefit from these videos. With this exercise, what we're gonna do is we're gonna activate the muscles between the shoulder blade. So the first thing that we did was work on thoracic mobility. We opened up the chest and we opened up the shoulder blades and the thoracic spine, the rib cage, all that stuff back there. So now what I'm gonna do is squeeze my shoulder blades down and back this way and open up the chest. I'm gonna hold it for 5 seconds and then I'm gonna relax. I'm doing 5 repetitions. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You notice I'm doing a chin tuck as well. So I'm really kind of lengthening, like somebody's kind of grabbing my hair. If I had hair, they'd be pulling it right here this direction. So I've got one more rep, holding that for 5 seconds, and then I rest. And now I'm gonna do 2 sets of 5, and that's it. Now I'm done with that. Now let me grab my model and I'm gonna explain exactly what we're doing. Okay, why are we doing this? It's important, I don't need that. Okay, so the neck is exposed, we just have muscles around it. At the thoracic spine, the rib cage, we have joint capsules, the rib cage, we have the shoulder blades, we have 9 muscles overlapping. We have a lot of stuff going on right here, so it's gonna get stiff on us. Here at the lumbar spine, we're exposed again, we just have muscles. And then at the pelvis and the hips, we got a lot of stuff going on. So primarily we need stability, mobility, stability, mobility, stability, and mobility. So if we are working on mobility through the thoracic spine, through the hips, and through the ankles, we're gonna age really well. We're not gonna have these problems that are happening when we're sitting for long periods of time because we're not losing that range of motion. So super simple routine of getting mobility through the thoracic spine, mobility through the hips, and mobility through the ankles. But if we don't follow it up with stability exercise, if we don't fire up those muscles through that range and that mobility, then we're gonna lose it. Our body's gonna create stiffness again. So make sure that you're consistent with this routine. If you're doing it at lunchtime, do it once when you get home, you're gonna have great benefit. If you just do it at lunchtime, it's gonna be really, really good for you. We're unraveling that position. There was an article I read probably 10 years ago that said sitting is the new smoking, and it's absolutely true. We're sitting, we're getting stiff, we've got to unravel that position. So do yourself a favor and do this program consistently. We'll see you in the next video.